What is life and recovery like after a man has his prostate removed? Many men believe that removing the prostate means living with urinary incontinence. That is, not being able to hold your urine anymore and not being able to have sex anymore. That's not true, okay? Today, in this video, I'm going to explain to you in a very practical and simple way how it really is, so you can understand and clear up all these doubts about this procedure, which is very important in the treatment of prostate cancer. Hi, I'm Dr. Tiago, and I'm a urologist here in Sao Paulo. Prostate cancer is the most common cancer in men, and early diagnosis allows us to cure the disease through surgery in more than 90% of cases. But what is life like for a man who has his prostate removed? The prostate is an organ located at the exit of the bladder, as you can see here in this diagram. It's that little organ that's yellow, really bright there on your screen. It's cut in half in this section we're looking at here, okay? As you can see, we have the bladder here and the urine passes through the channel, with the first part of the urinary tract being the prostate, which we call the prostatic urethra. The prostate has an exclusively reproductive function. It's not a vital organ for our body. That's why one of the most common treatments for prostate cancer is removing the gland. The prostate produces seminal fluid and it creates a connection. It's a bridge between the urethra and the reproductive system. So, sperm is produced in the testicle and it's stored in the epididymis, which is an organ next to the testicle. When you ejaculate, the sperm leaves the epididymis, travels through a duct, reaches the seminal vesicle, mixes with all that fluid, and is pushed forward into the urethra, and you expel it through the canal. So, what happens to all of this after a man has his prostate removed? Well, let me imagine this. You're waking up from anesthesia after having your prostate removed. I'll talk in a bit about the techniques, which techniques we can use to remove the prostate. The surgery is over, you wake up from anesthesia, the anesthesia is general, and you go to a room we call the recovery room. In this room, you'll stay for about an hour and a half, until you're more awake from the anesthesia, and then you go to your room. In the room, usually, you're already able to eat. So, it's a surgery that doesn't require fasting after the procedure. We don't touch the intestines. So, the patient finishes the procedure, goes to the recovery room, then to their room, and can already eat. Remember I showed you that we need to remove the entire prostate, and the prostate is the first part of the channel. So, we reconnect the channel directly to the bladder. This involves stitching, which we call an anastomosis. And it's at this anastomosis that, to prevent problems and reduce the chance of complications, we insert a catheter, which we call an indwelling urinary catheter. So, the patient won't be urinating or going to the bathroom to pee right after the surgery, because the catheter itself removes the urine as it's produced, draining it directly out so that the urine doesn't pass through the channel and interfere with the healing of the anastomosis. The patient will stay in the hospital for about 24 to 48 hours, okay? In the vast majority of cases, 24 hours is enough. The patient goes home already on the first day after surgery, as we call it, with this catheter. This catheter stays in for about a week to 15 days, right? At home, during these first days after surgery, these first days of recovery, we recommend what we call relative rest, okay? You're not supposed to stay in bed 24 hours a day, and you're not supposed to just stay on the couch. You should take short walks inside your house, inside your apartment. You can have small gatherings, go along for a trip to the market, the bakery, or even to church services, whatever you find interesting. But obviously, you can't lift heavy things, you can't do physical activity, you can go upstairs slowly and preferably with someone accompanying you. Then, after those 15 days, the patient comes back to the office to have the catheter removed. The catheter is removed, and we advise the patient to bring a pad. Why? This is where the first concern patients have about prostate surgery comes in: urinary incontinence. I showed you, and you saw that the prostate is the first part of the channel. And something interesting here as well, look, is this little muscle here and this one, which we call the urethral sphincter. There's both the internal and the external one. They are responsible for continence. Since we operate very close to them, they may have some degree of difficulty maintaining continence, especially in these first days or even a few months after the procedure. And that's where pelvic rehabilitation comes in, with physical therapy, where, through some specific exercises, the physical therapist will teach you how to work not only these muscles, but also the muscles around them, which we call the pelvic diaphragm, and which are also important for maintaining urinary continence, both in men and women. And then this man will have a mild degree of incontinence. It's not usually a severe incontinence where the patient starts urinating without noticing or just keeps urinating constantly. No, it's a mild incontinence. So, what usually happens? When the bladder is a little fuller, if he does any kind of effort, increases pressure, coughs, sneezes, or lifts something heavy, there will be a small leak. And this incontinence tends to improve over the months, usually within about 3 months at most. Most people, I say most, not everyone, will have fully regained continence, though sometimes there might still be some small leaks when the person exerts themselves a lot, okay? That's the case for the vast majority of patients. Doctor, but I know someone who had prostate surgery and he's still incontinent to this day. Yes, that can happen, and it usually happens when the disease is more advanced. So, what are the chances of that happening? The rates of incontinence vary from about 5 to 15%, and we use this number after 1 year. It can take up to a year for some people to fully regain continence. So, after 1 year, we look at everyone who had prostate surgery. Out of every 100, how many are completely continent and how many are incontinent? 85 to 90 will be completely continent, and generally 5 to 10% may have some degree of incontinence that will require some other treatment for incontinence. Doctor, if I become incontinent, is there nothing else I can do? No, nowadays, we have reconstructive surgeries using some devices, such as the artificial urinary sphincter, which is a mechanical device placed in a urinary channel that helps the person regain continence, and also what we call a sling, a surgery where we reinforce the area under the urethra so the patient can regain continence after the treatment, okay? But getting back to the topic, and what about erectile dysfunction? When the patient undergoes surgery, as you saw in the illustration, prostate cancer surgery involves an area with nerves, and those nerves are responsible for erections. They aren't inside the prostate, they're on the outside of the prostate, but just like muscle is sensitive, nerves are too. So, even if we manage to preserve those nerves, and I say manage because the main goal of the treatment is to cure the person of cancer. With more advanced cancers, sometimes the surgery needs to be more radical. I need to remove more tissue around the area to make sure all the cancer is taken out, and then the nerves responsible for erections end up being removed as well, which increases the chance of erectile dysfunction. That's why you need to get an early diagnosis. Early diagnosis increases your chances of staying continent after surgery, allows the surgery to be more limited to your prostate, and also increases your chances of maintaining potency. What are the chances of impotence after 1 year? It can take up to a year for the nerve to recover from the procedure, and the rate is around 25 to 30%. Those are the rates reported in the literature, right? Worldwide, that's the rate of sexual impotence after prostate removal surgery for prostate cancer. So you have a 5% chance of becoming incontinent, a 30% chance of becoming impotent, and a 90% chance of being cured, not dying from prostate cancer. Because sometimes people forget that they have cancer, we talk so much about impotence and continence, but the main thing is that there's a disease that will kill you if you don't treat it. So, what have the new techniques added to the treatment? Now, let me show you this image here, and I'll explain what it is. We basically have 3 techniques to operate on the prostate: open surgery with a conventional incision, then came video laparoscopic surgery, and now robot-assisted surgery. Robot-assisted surgery is not actually performed by a robot. The urologist, the main surgeon, stays next to the patient at what we call the console, operating there at the console, and the instruments move according to the doctor's manipulation. And then there's an assistant in the operating field, helping with the robot's arms. So, robot-assisted surgery is not performed by a machine. The one actually operating is still the urologist, right? And these more modern, more technological techniques allow us to perform a more delicate surgery, and that's where the benefits come in. The first benefit is robotic surgery, compared to laparoscopic surgery, has a faster rate of continence recovery. So, remember I told you that when you leave, we ask you to bring a pad because you'll have a certain degree of incontinence after the catheter is removed. When you have robotic surgery, you generally recover continence faster than if you have laparoscopic surgery. At the end of a year, the continence rates are very similar, but for someone who is losing urine for a week or 15 days, it makes a big difference, and sometimes it's a matter of months earlier. So, if you have laparoscopic surgery, you would recover your continence in 3, 4, or 5 months. If you have robotic surgery, urinary continence is regained sooner, around a month and a half to 2 months, or 3 months in some cases. This varies a lot from person to person, okay? That's just an average. Some patients recover sooner, while others take a little longer. But overall, robotic surgery allows the patient to regain urinary continence sooner, and the same goes for erections, okay? And there are other complications that are less common with robot-assisted surgery. This table you're seeing here has 3 columns, right? 4, actually. Here it's talking about the complication in English. I'll explain it in a moment. This RAUP here is the robotic surgery, laparoscopic is the laparoscopic surgery, and RRP is the open surgery. This table was taken from the European Urology Guidelines, okay? I didn't make this up. I didn't invent it. These are data from the literature that are collected and included in the European Guideline for prostate surgery. You can access it. It's free. Bladder neck contracture. What is that? It's a constriction of the anastomosis, meaning when you reconnect the prostate, that area can close up. So when you do the surgery with a robot, this is much less likely to happen than with open surgery. Anastomosis leak, which means leakage. In other words, the anastomosis opened up. Infection, organ injury, and thrombosis. We can see that robotic surgery has fewer complications in almost every aspect compared to both laparoscopic and open surgery. So, robotic surgery is indeed superior to laparoscopic surgery, which is infinitely better than open surgery. In terms of complications, okay, when it comes to recovery, you recover faster and have a better postoperative recovery. Regarding effectiveness, the chances of being cured of the disease are the same for robotic, laparoscopic, and even open surgery. All 3 types of surgery offer similar levels of effectiveness. If I look solely and exclusively at the goal of treating cancer, curing cancer, all three are the same. But we know that since it's a major surgery with a postoperative period, recovery, and possible after effects, we need to look at other factors like continence rates, impotence rates, and other complications related to the procedure, which are these here, right? So, as you can see, most men, let's say about 70%, will have erections, will have continence after prostate removal, and will be cured of the disease. So, removing the prostate is not the end of a man's life. On the contrary, if you have cancer and don't remove it or don't get treatment, then yes, it could be the end of your life. See your urologist to get your prostate exams. It's very important that this diagnosis is made early because your chances of having effective treatment, of a minimally invasive treatment working, and of you remaining continent and potent are much higher than if you don't get treated, right? Doctor, I had surgery. It's been a year and a half, and I'm still impotent. I'm incontinent. Is there anything that can be done? Yes, again, regarding incontinence, we can use devices like the sling and the artificial sphincter, okay? And for impotence, we can use both oral medications and injectable medications, and even a penile prosthesis, which is indeed a very effective treatment for erectile dysfunction after prostate surgery. Deal. I know, getting a prostate cancer diagnosis isn't easy, but believe me, the treatment is effective, it allows for a cure, and it's not the end of a man's life, all right? I hope you understood this video. Don't forget to like the video, subscribe to the channel, and see you in the next video.